So the first thing you want to do is pick out a few different tube sizes. Usually you want to pick out at least 3, so that way you're not trying to dig around and find a tube that will fit the patient. You also want to have some lube setting out on a gauze pad, and your laryngoscope, a tie, and then a syringe for inflating the cuff. So with this patient, we'll go ahead and start the induction process. Already given the pre-med. So usually you want to pick a size of cuff that's going to kind of line up. Usually I like to line it up with the philtrum of the front of the nasal passage and kind of measure which tube might be best for going in. So I'm going to go ahead and try our 11. And I usually put our tie on. Usually I just wrap it around like this so that way it's nice and secure, but yet I can easily manipulate it and move it if I need to. The other thing you can do for measuring wise is always you can always measure to the thoracic inlet before intubating the patient and kind of place your tie where you believe it'll be wrapped around the top of the nasal area. So that's one way to measure how deep. And then you use your laryngoscope. I'll kind of show you. So with the laryngoscope, you want the blade. You can kind of see how the soft palate is down over the top of the glottis. You can use the end of the blade to kind of push that out of the way, push it down. You never want to use the blade on the glottis. You just want to go ahead and push it straight down. And you can kind of use your tube to help open up and visualize the laryngeal arytenoids or vocal folds, and you can see clearly down into the trachea. You'll go ahead and pass your tube, and usually I'll go ahead and secure this and then kind of feel where I am for placement. We'll go ahead and put the patient in lateral recumbency. You can kind of feel the trachea to make sure you're not in the esophagus, and so we are good placement. You can also verify by seeing condensation in the tube, and then we'll go ahead and hook the patient up to the breathing circuit. Wait on that. Go ahead and let the bag fill up a little bit here. So usually you'll want to first listen for a leak before inflating the cuff. And so clearly there's a leak. You can hear it coming through. So we'll grab our syringe and start to inflate the cuff. You don't want to inflate. So I'll put a little bit of air in there. We'll check it again. Okay, this time it's holding air, so I'll go ahead and hold it up to 20 centimeters of water. Nothing, I don't hear a leak, so we're good there. We don't need to put any more air in.